think we're recording. Yeah, okay, so we started recording. We'll go ahead and get started. Like I mentioned, if you haven't already signed in, please go ahead and do that, and then we'll go ahead and get started. All right, so our first question is, a nurse on a pediatric unit is caring for a toddler. Which of the following behaviors is an effect of hospitalization? Select all that apply. A, believes the experience is a punishment. B, experiences separation anxiety. C, displays intense emotions. D, exhibits regressive behaviors. Or E, manifests disturbance in body image. And you guys can go ahead and put the answer in the chat. All right, I see some answers rolling in. I'll give you guys another little bit. And we'll talk through all of these too. All right, so in the chat, I see a lot of A, B, C, and D. So let's go through it. So A, believes the experience is a punishment. So A is not correct because that's going to be more of like a preschool, school age child. B, C, and D are going to be correct. So B, the toddler experiences separation anxiety. C, the toddler displays intense emotions. And D, the toddler exhibits regressive behaviors. So good job with that one. Nobody clicked E, or nobody picked E. That's good. That would be more of like an adolescent. But the reason that A is incorrect is because the toddlers are still too young to like believe that it's a punishment. Don't infants also display intense emotions? I mean, infants are gonna be like crying and things like that. But in terms of like displaying super intense emotions, you're gonna see like temper tantrums and stuff with toddlers. So hopefully that makes sense. But good job, guys. All right. A nurse is caring for a child who is dying. Which of the following are findings of impending death? Select all that apply. Heightened sense of hearing, tachycardia, difficulty swallowing, sensation of being cold, or chain strokes, respirations. All right, good job, guys. So the answer is C and E. Difficulty swallowing and the chain strokes, respirations. A lot of you guys picked D. Honestly, I would have picked D too. But it's not the sensation of being cold. It's just like them being cold to the touch. So that's why D isn't correct. But really good job with C and E. Good job, guys. A nurse is teaching a guardian about complicated grief. Which of the following statements should the nurse make? Complicated grief occurs when little time is spent thinking about the loss. Personal activities are rarely affected when experiencing complicated grief. Guardians will experience complicated grief together, or counseling can be helpful in resolving complicated grief. All right, you guys got this one. It's D, counseling can be helpful in resolving complicated grief. Really good job, guys. All right, a nurse is teaching a caregiver of a preschool-age child about factors that affect the child's perception of death. Which of the following factors should the nurse include in the teaching? Preschool children have no concept of death. Preschool children perceive death as temporary. Preschool children often regress to an early stage of behavior, or preschool children experience fear related to the disease process. All right, you guys did really, really well with this one as well. So you guys are correct. It is B, preschool children perceive death as temporary. Good job, guys. All right, a nurse often cares for children who are dying. Which of the following are actions for the nurse to take to maintain professional effectiveness? Select all that apply. A, remain in contact with the family after their loss. B, develop a professional support system. C, take time off from work. D, suggest that the hospital representative attend the funeral. Or E, demonstrate feelings of sympathy toward the family. All right, I see lots of answers rolling in. Lots of B's and E's. So the answer is actually A, B, and C. So remain in contact with the family after their loss, develop a professional support system, and take time off from work. The reason that E is not correct is because it says feelings of sympathy. So this is like a tricky one, and why I wanted to put it on there, but you should be demonstrating empathy instead of sympathy. So there's like the differences between that. You want to be empathetic towards them, rather than sympathetic. But that's why E is not correct. But good job, guys. All right. The next one. A nurse is caring for a child who has a terminal illness and reviews palliative care with the assistive personnel. Which of the following statements by the assistive personnel indicates understanding of this review? I'm sure the family is hopeful that the new medication will stop the illness. I'll miss working with this client now that only nurses will be caring for them. I will get all the client's personal objects out of the room, or I will listen and respond as the family talks about their child's life. All right, good job, guys. You guys did really well with this one as well. So this one is an I will listen and respond as a family talks about their child's life. So this is one of those therapeutic communication questions. So good job, guys. All right, a nurse is teaching an adolescent to self-administer a corticosteroid medication using a metered dose inhaler. Which of the following instructions should the nurse include? Select all that apply. A, shake the device prior to use. B, rinse and expectorate after administration. C, inhale slowly with medication administration. D, exhale quickly after medication administration. And E, wait 30 seconds between puffs. Okay, awesome job, you guys. You guys got this one. It is A, B, and C. Really good job, guys. We just did that one. Okay. A nurse is caring for a child who is receiving oxygen therapy and is on a continuous oxygen saturation monitor that is reading 89%. Which of the following actions should the nurse take first? A, increase the oxygen flow rate. B, encourage the child to take deep breaths. C, ensure proper placement of the sensor probe. Or D, place the child in the Fowler's position. All right, awesome job with that one as well, you guys. So it is C, ensure the proper placement of the sensor probe. This one is really like one of your assessment type questions. So you always want to make sure that you fully assessed before you take any action. So you're assessing if the sensor probe is in the proper placement. All right. A nurse in the emergency department is assessing a newly admitted infant. Which of the following findings is an early indication of hypoxemia? A non-productive cough, hypoventilation, tachypnea, or nasal stuffiness? Good job, guys. The answer is C, tachypnea. You guys are killing the respiratory questions, so you guys should feel really good about that. All right, a nurse is caring for a child who is receiving oxygen. Which of the following findings indicates oxygen toxicity? Increased blood pressure, hyperventilation, decreased PaCO2, or unconsciousness? All right, I see some answers have rolled in, so we'll go ahead and talk about it. You guys that answered were absolutely correct. It's D, unconsciousness. The increased blood pressure isn't really related to this. Hyperventilation, if you have oxygen toxicity, it would be hypoventilation, and it would be increased PaCO2. So unconsciousness is correct. A nurse is caring for a child who is receiving a bronchodilator medication by nebulized aerosol therapy. Which of the following actions should the nurse take? Select all that apply. Instruct the child that the treatment will last 30 minutes, obtain vital signs prior to the procedure, tell the child to take slow, deep breaths, determine if the child should use a mask, or attach the device to an air source. see lots of correct letters in the chat. So you guys are doing good. I'll give everybody a couple more seconds to get an answer in the chat, and then we'll go through this one. All right, guys, so for this one, the correct answers are B, C, D, and E. So A is not correct. The treatment will last about 10 to 15 minutes, not 30. But you always want to obtain vital signs prior, and then tell the child to take slow, deep breaths. That's going to be really important. And then D and E, you want to determine if the child should use a mask, and you should attach the device to an air source. So everything but A is correct in that one. But really good job, you guys. All right, a nurse is caring for a child who has bronchiolitis. Which of the following actions should the nurse take? Select all that apply. Administer oral prednisone, initiate chest percussion and postural drainage, administer humidified oxygen, suction the nasopharynx as needed, and administer oral penicillin. All right, good job, you guys. So the answer for this one is going to be C, administer humidified oxygen, and D, suction the nasopharynx as needed. So you guys did really good getting that one. Initiate chest percussion and postural drainage really isn't going to apply to this one. A lot of the times you just see this one with like cystic fibrosis patients. But good job. Okay, a nurse is assessing a child who has epiglottitis. Which of the following findings should the nurse expect? Select all that apply. Hoarseness and difficulty speaking, difficulty swallowing, low-grade fever, drooling, and stridor. So I'll give you guys a minute to do that one. I will tell you this one was like a super stressed disease process for us last semester. So remember epiglottitis. Don't put anything in their mouth. That's like a huge key one. All right, awesome. You guys definitely got this one. You guys are correct. So it's A, B, D, and E. Hoarseness and difficulty speaking, difficulty swallowing, drooling, and stridor. The reason that C is incorrect is because it's a high-grade fever. Sorry, there are like trains going past the apartment. So if it gets loud, I'm sorry. All right, our next one, a nurse is caring, that's what it should say, for a child who has asthma. Which of the following are indications of deterioration in the child's respiratory status? Select all that apply. Oxygen saturation 95%, wheezing, retraction of sternal muscles, warm extremities, or nasal flaring. All right, really good job, you guys. You guys all got this one super fast. wheezing, retraction of sternal muscles, and nasal flaring. Good job. A nurse is teaching an adolescent about the appropriate use of his asthma medications. Which of the following medications should the nurse instruct the client to use as needed before exercise? Salmeterol, montelukast, prednisone, or albuterol? All right, good job, you guys. The answer is D, albuterol. That's going to be our bronchodilator. So good job. A nurse is planning care for a child who has asthma. Which of the following interventions should the nurse include in the plan of care? Select all that apply. Perform chest percussion, place the child in the upright position, monitor oxygen saturation, administer bronchodilators, and administer Dornase alpha daily. All right, great job, you guys. The answer is B, C, and D. So these are all going to be super important things that we do for a kiddo with asthma. Does anybody know what disease process you would do A and E for? A little bonus question in there for you. It's the same disease process. Yeah, cystic fibrosis. Good job, guys. Nice job. All right, a nurse is teaching a child who has asthma how to use a peak flow meter. Which of the following information should the nurse include in the teaching? Select all that apply. Zero the meter before each use, record the average of the attempts, perform 3 attempts, deliver a long, slow breath into the meter, sit in a chair with feet on the floor. All right, good job, guys. Let's go over this one. So the answer is A, zero the meter before each use, and C, perform 3 attempts. For B, we're not going to record the average of the attempts. We want to record the highest attempt. So that's something that's going to be super, super key. Make sure that you remember that even for like your CH1 exams. I remember seeing that on there too. So remember, you're recording the highest one, not the average. E, it's not going to be E because you're not sitting with your feet on the floor. You're going to be standing for this test. And then you don't want a long, slow breath. You want it to be quicker than that. But really good job, guys. All right, a nurse is discussing risk factors for asthma with a group of newly licensed nurses. Which of the following conditions should the nurse include in the teaching? Select all that apply. Family history of asthma, family history of allergies, exposure to smoke, low birth weight, and being underweight. Yeah, great job, you guys. So the answer is A, family history of asthma, B, family history of allergies, C, exposure to smoke, and D, low birth weight. Really great job on that one. All right, a nurse is reviewing the diagnostic findings for a preschool-age child who is suspected of having cystic fibrosis. Which of the following findings should the nurse identify as an indication of cystic fibrosis? A, sweat chloride content of 85, increased blood levels of fat-soluble vitamins, 72-hour stool analysis sample indicating hard-packed stools, or chest x-ray negative for atelectasis. Great job, you guys. You guys were on this one. It is A, sweat chloride content over 85, or of 85. Good job. A nurse is performing an admission assessment for a child who has cystic fibrosis. Which of the following findings should the nurse expect? Select all that apply. Wheezing, clubbing of fingers and toes, barrel-shaped chest, thin watery mucus, and rapid growth spurts. All right, really great job with this one as well, you guys. The answer is wheezing, clubbing of fingers and toes, and barrel-shaped chest. The reason that it's not going to be D is it's like really thick, viscous mucus, not thin and watery. And then they have decreased growth rather than rapid growth spurts. But really great job. You guys all got that one really quick. A nurse is providing discharge teaching for a child who has cystic fibrosis. Which of the following instructions should the nurse include? Provide a low-calorie, low-protein diet, administer pancreatic enzymes with meals and snacks, implement a fluid restriction during times of infection, or restrict physical activity. All right, you guys really know cystic fibrosis because you're getting these really, really quickly. So, yep, you guys are totally correct to administer pancreatic enzymes with meals and snacks because they have pancreatic insufficiency. Good job. All right, a nurse is teaching a group of caregivers about fractures. Which of the following information should the nurse include in the teaching? Children need a longer time to heal from a fracture than an adult. Epiphyseal plate injuries can result in altered bone growth. That was difficult to say. A green stick fracture is a complete break in the bone, or bones are unable to bend, so they break. Nice job, you guys. The answer is B, correct. All right. A nurse is caring for a child who has a fracture. Which of the following are manifestations of the fracture? Select all that apply. Crepitus, edema, pain, fever, ecchymosis. All right, good job with this one, you guys. So the answer is crepitus, edema, pain, and ecchymosis. So the only one that you wouldn't have selected is fever. So everybody got edema, everybody got pain, and the ecchymosis. But the reason that you're gonna have the crepitus is because if you have a fracture and it's like broken in multiple places and you have a lot of different pieces, then you can start to hear that like grating sound, which would be the crepitus. So good job, guys. A nurse is caring for a child who is in skeletal traction. Which of the following actions should the nurse take? Select all that apply. Remove the weights to reposition the client, assess the child's position frequently, assess pin sites every 4 hours, ensure the weights are hanging freely, and ensure the rope's knot is in contact with the pulley. right, really great job, you guys. So the answer is going to be B, C, and D. So we're going to assess the child's position frequently, assess pin sites every 4 hours, and ensure the weights are hanging freely. It's not going to be A. We don't want to remove the weights. And then it's not E because the knot shouldn't be in contact with the pulley. Really good job with that one, though, guys. All right, our next one, a nurse is caring for a child who is suspected of having leg calf Pert's disease. The nurse should prepare the child for which of the following diagnostic procedures: bone biopsy, genetic testing, CT scan, or radiograph. Awesome job, you guys. So the answer for this one is D, radiographs. You guys got that one really fast. A nurse is assessing a child who has leg calf Pert's disease. Which of the following findings should the nurse expect? Select all that apply: longer affected leg, hip stiffness, back pain, limited range of motion, and limp with walking. All right, good job with this one, you guys. So the answer for this one is going to be hip stiffness, back pain, limited range of motion, and limp with walking. You guys got all of it except C, so that's really good. They can experience some back pain if you kind of think about it. If you're like walking kind of funny, that can like affect your posture and your back and stuff, and like you can start having back pain with that. So hopefully that kind of helps you remember that one. But everything else you guys got really well, and then it would be a shorter effective leg rather than a longer effective leg. Good job with that one, guys. A nurse is caring for a child who has muscular dystrophy. Which of the following findings should the nurse assess? Select all that apply: purposeless involuntary abnormal movements, spinal defect and sac-like protrusion, muscular weakness in lower extremities, unsteady wide-based or waddling gait, and upward slant to the eyes. Great job with this one, guys. The answer is C and D. So muscular weakness in lower extremities and unsteady wide base or waddling gait. You guys got that one, so good job. A nurse is assessing an infant who has scabies. Which of the following findings should the nurse expect? Select all that apply. A, presence of nits on the hair shaft. B, pencil-like marks on the hands. C, blisters on the soles of the feet. D, small red bumps on the scalp. Or E, pimples on the trunk. All right, let's go over this one. I'm seeing lots of answers, lots of different answers for this one. But the correct answer is going to be B, pencil-like marks on the hands, C, blisters on the soles of the feet, and E, pimples on the trunk. So you're not going to have nits in the hair shaft with scabies, and you're also not going to have small red bumps on the scalp. So just remember the pencil-like marks, the blisters, and then the pimples on the trunk. Good job, guys. A nurse is teaching a group of parents about preventing insect bites. Which of the following information should the nurse include in the teaching? Select all that apply. A, wear perfumes when outside. B, avoid areas of tall grass. C, wear bright colored clothing. D, wear insect repellent. And E, check house pets frequently. Great job with this one, you guys. So the correct answer is B, avoid areas of tall grass. D, wear insect repellent. And E, check house pets frequently. So it's not going to be A, we don't want to wear perfumes when outside because that can attract them. And then the same with the bright colored clothing. So good job. A nurse is caring for a client who has cellulitis on the hand. Which of the following actions should the nurse take? A, administer oral antibiotics. B, cleanse area using boro solution. C, prepare for cryotherapy. Or D, apply topical antifungal medication. Really good job, guys. You guys got that one really quickly. It is going to be A, administer oral antibiotics. Before we move on to the next one, I just saw a question in the chat. I thought perfumes referred to bug spray. So no, if it's bug spray, it'll explicitly say like bug spray or insect repellent. So if we go back to this one, we had wear insect repellent. So that's going to be different than wearing perfumes. You're welcome. All right. Moving on to our next one. We did that one. Yeah, we just did that one. Okay. A nurse is planning care for a child who has tinea capititis. I definitely did not say that correctly. I can't talk today. Sorry, guys. Which of the following actions should the nurse include in the plan of care? Select all that apply. Treat infected house pets. Use selenium sulfide shampoo. Cleanse area with boro solution. Administer antiviral medication. Use warm, moist compresses. That was very difficult to all say. Sorry. All right, seeing a lot of answers for this one, so let's go over this one. The correct answer is A and B. So it's treat infected house pets, and B, use selenium sulfide shampoo. These are going to be your two care for that one. The other ones aren't really going to apply to this specific disease process, but great job, you guys. A nurse is teaching the guardian of an infant who has seborrheic dermatitis of the scalp. Which of the following instructions should the nurse include in the teaching? You can use petrolatum to help soften and remove patches from the scalp. I can talk. When patches are present, you should keep your infant away from others. You should avoid washing your infant's hair while the patches are present. And when patches are present, it indicates that your infant has a systemic infection. A. Good job, you guys. Use the I'm not going to try to say that again. But you're going to use that to help soften and remove patches from the scalp. And then going back to a question we had from the previous question, what is the Burrow solution? It's like a topical that you put on for itching and stinging. So hopefully that helps. A nurse is caring for a child who has contact dermatitis due to poison ivy. Which of the following actions should the nurse take? Select all that apply. Remove the clothing over the rash, initiate contact isolation precautions, expose the rash to heat lamp for 15 minutes, cleanse the affected area in hydrogen peroxide solution, or E, apply calamine lotion to the skin. Great job, you guys. The answer for this one is A, remove clothing over the rash, and E, apply calamine lotion to the skin. You guys all got that one, so great job. A nurse is planning care for a client who has diaper dermatitis. Which of the following actions should the nurse include in the plan of care? Select all that apply. A, apply talcum powder with every diaper change. B, allow the buttocks to air dry. C, use commercial baby wipes to cleanse the area. D, use the cloth diapers until the rash is gone. E, apply zinc oxide ointment to the affected area. Really awesome job, you guys. You guys got that one really fast. The answer is B and E. I did see an A in there, so the reason that we're not going to use the talcum powder is it can like cake on and make it even more irritated. But the zinc oxide ointment is what we're going to use, and then you want it to air dry. Good job. A nurse is assessing an infant who has eczema. Which of the following findings should the nurse expect? Select all that apply. A, generalized distribution of lesions. B, papules. C, ecchymosis in flexural areas. D, keratosis pilaris. Or E, crusting lesions. All right, let's go over this one. So this one is A, generalized distribution of lesions, B, papules, and E, crusting lesions. So the reason that it's not going to be the ecchymosis in the flexural areas is it would be lesions in those areas. But you are going to have generalized distribution of the lesions. They can be crusting, and then you can also see papules. All right, moving right along. A nurse is caring for a child who has a superficial partial thickness burn. Which of the following actions should the nurse take? Administer IV infusion of normal saline, apply cool wet compress to the affected area, clean the affected area using a soft bristle brush, or D, administer morphine sulfate. All right. I see some A's and B's. So the correct answer for this one is going to be B. We're going to apply a cool, wet compress to the affected area. That's going to be our best thing to treat or to care for the burn directly. All right, a nurse is caring for a child who is experiencing respiratory distress. Which of the following findings are early manifestations of respiratory distress? Select all that apply. A, bradypnea, B, peripheral cyanosis, C, tachycardia, D, diaphoresis, E, restlessness. All right, really great job with this one as well, you guys. So the correct answer is tachycardia, diaphoresis, and restlessness. For restlessness, if they're having respiratory distress, they're having trouble breathing, that's really scary. So they're probably going to seem really restless, and you see the same thing in an adult too. A nurse in a community center is providing an in-service to a group of parents on management of airway obstruction in toddlers. Which of the following responses by one of the caregivers indicates understanding? Select all that apply. A, I will push on my child's abdomen. B, I will hyperextend my child's head to open the airway. C, I will listen over my child's mouth for sounds of breathing. D, I will use my finger to check my child's mouth for objects. E, I will place my child in my car and take them to the closest emergency room. All right, so let's go over this one. The correct answer is going to be A and C. I will push on my child's abdomen and I will listen over my child's mouth for sounds of breathing. So you want to push on their abdomen to try to open up free their airway. You don't want to hyperextend their head because that can cut off their airway. And then you want to listen over their mouth for sounds of breathing. You don't want to stick anything in their mouth. So you don't want to stick your finger in the mouth. And then for E, I know that one can be really confusing too. You don't want to initially take them to the closest emergency room. You want to call 911 first. So that is why E is not correct. All right, so that is it for all of the questions that I have for you guys today. I'll go ahead and end the recording, and then I'll stick around as well for any questions that you guys might have.